The family of South African rapper Costa announced on Instagram that he passed away suddenly on the weekend, only hours after playing at a music event. Musician Konstantinos Sobanoglu died at the young age of 28. Social media images appear to show Sobanoglu collapsing on stage and having to be helped up by an assistant. Sobanoglu stands for what seems like several seconds before he collapses. The family of Sobanoglu wrote on his Instagram that they were very pained to have to accept his demise at this time. We appreciate everyone who was there with him in his final hours, especially the emergency personnel. The reason of death was not specified in the announcement. Ultra South Africa, the festival where he was scheduled to perform, said it was devastated by the news of the young rapper's death. Costa was a galvanizing voice within South Africa's Amapiano scene, a talented rapper, dancer, singer, songwriter, collaborator, and friend to the festival, statement said. Sobanoglu was one of the most popular musicians in South Africa at the time. His music was considered to be Amapiano, a genre that features deep house, log drum-driven bass lines, and soulful piano melodies. His lyricism incorporates elements of international rap subgenres, including trap music, which has its roots in Atlanta's burgeoning hip-hop industry, as well as South African culture, style, and indigenous languages. Sobanoglu started out as a dancer before transitioning to rapping. He was born in Nelspruit, which is in the northeast of South Africa. The Senegalese-American musician Akon, who is featured on a remix of Big Flexa, has just joined with the rapper's record company. Kostatich, whose songs include Big Flexa and Activate, started his career as a backing dancer before making the transition to a rapper. In February, he announced on Instagram that he had partnered with fellow rapper Akon's record label, Convict Culture.
Seizures have been with us since the beginning of recorded history. Today, we know the science behind seizures. The search continues for a cure, but effective first-line therapies are already proven. This video provides an overview of seizure types and treatment options, essential information for you, the EMS responder. More than 50 million people worldwide live with epilepsy. Every year, millions more suffer seizures from other causes. The brain consumes 20% of the body's oxygen and 30% of cardiac output. Problems can occur when glucose, blood flow, oxygen, or electrical activity deviate from the norm. Seizures are caused by abnormal electrical discharges in the brain and are classified as either generalized or partial. Those that are generalized, such as tonic-clonic, are the result of abnormal electrical activity affecting the entire brain. These seizures are obvious to the observer: a rapid loss of consciousness, falling to the ground, full body convulsions. Generalized tonic-clonic seizures often result in calls for EMS response. Partial seizures, however, are more difficult to recognize. In partial seizures, only part of the brain is affected by the abnormal electrical activity. Symptoms presented depend on which area of the brain is affected. Simple partial seizures cause changes in sensation or motor activity in part of the body, but do not result in a loss of awareness. On the other hand, complex partial seizures do result in a loss of awareness, though the person stays conscious. They may exhibit a blank stare, repetitive motions, or an emotional disturbance. Complex partial seizures can be difficult to recognize and can easily be confused with drug or alcohol abuse. Those who experience recurrent, unprovoked seizures are diagnosed with epilepsy. There are certain things that may trigger seizures in people with epilepsy, such as flashing lights, hunger, stress, and sleep deprivation. For people without epilepsy, the list of possible seizure causes is long, and it's not always possible to determine the cause while on the scene. But it is possible to prevent secondary injuries from environmental factors, and with medication and oxygen, help prevent possible neurological damage from prolonged seizures. While most seizures do not cause permanent neurological damage, prolonged seizures can be life-threatening.
County's requesting an ambulance from Station 1 and an officer to respond to 700 Point on Main, 1100 Main Street, for a female having a seizure.
You respond to a report of a person on the ground in convulsions. The first thing upon arriving is to size up the scene. Make sure the area is safe. Look around for signs of environmental factors that could have caused it, such as downed electrical wires or a chemical spill.
Then, check the patient's level of consciousness and response using AVPU. Look for evidence of trauma, drug, or alcohol use. Talk to witnesses. When did the seizure start? What was the person doing just prior? Their information could provide vital clues. Make sure to look for a medical ID bracelet, watch, or pendant. Many people with epilepsy or diabetes wear an ID with an emergency phone number and a clear labeling of their condition. Check the person's belongings for prescription medications that may give a clue regarding a potential illness. Also, a growing number of people have an ICE listing in case of emergency contact in their cell phone directory.
There's ICE.
At this point, you should be able to assess whether this is an urgent situation requiring rapid medical intervention or one where you can take a more conservative approach. Now, let's look at two common forms of seizures: generalized tonic-clonic and complex partial, and the postictal post-seizure state. Generalized tonic-clonic is the most dramatic of seizures, affecting both hemispheres of the brain. The result: severe muscle spasms, loss of consciousness, muscle rigidity.
The convulsive period of a tonic-clonic seizure rarely lasts longer than 3 to 4 minutes. In the vast majority of cases, the seizure itself poses no life-threatening risk. However, the environment can present a threat.
Clear the area to prevent injury during convulsions. If possible, place the person on their side in the recovery position to allow secretions to drain and suction as necessary. Don't try to restrain their movement, but protect their head and extremities as they convulse. Don't put anything in their mouth. In fact, check to make sure a bystander hasn't inserted an object, thinking it was the right thing to do. Your first priorities, even while the patient is still seizing: check their level of consciousness, their LOC. Provide and maintain a clear airway. Assess respiratory status and provide oxygen if necessary. Next, as soon as seizing stops, assess pulse rate. Assess blood sugar and treat if necessary. Perform a head-to-toe evaluation for other injuries. When providing a clear airway, keep in mind that the preferred device is the nasopharyngeal airway, the NPA. If necessary, suction for secretions until the patient is alert enough to maintain their own airway.
Next, assess the respiratory status. During a seizure, the victim may become apneic or develop peripheral cyanosis due to respiratory muscles being paralyzed. This should be a temporary state that resolves itself as the tonic spasm portion of the seizure subsides, usually in 10 to 30 seconds.
All seizure patients should be placed on high-flow oxygen via a non-rebreather mask. Monitor the patient closely and be ready to provide positive pressure ventilation if necessary. Monitor LOC for changes. Next, check their pulse rate. Seizures sometimes occur just prior to cardiac arrest, so continue to monitor closely.
Most seizures are self-limiting and subside within 3 to 4 minutes or less. But seizures that last longer than 5 minutes can cause more serious neurological and other organ damage. In fact, if you can confirm that seizure activity has lasted longer than 5 minutes, or that the patient has had repeated seizures without regaining consciousness in between, they may be having a prolonged seizure or even status epilepticus, a true life-threatening state with extremely high mortality rates.
The goal is to stop the seizure as soon as possible. These patients need immediate aggressive treatment, oxygenation, and medication. If authorized, obtain vascular access and consider the following medications to reduce or eliminate the seizure activity. Benzodiazepines are the most common class of drugs given to rapidly stop an active seizure. Several are available, each with its own benefits. Diazepam, known by the brand Valium, is a common choice. Lorazepam, known as Ativan, has the advantage of duration of effectiveness, a few hours versus 30 to 40 minutes for diazepam. Midazolam, also known as Versed, has the advantage of being able to be given IV or IM. Diastat, available by prescription, is administered rectally for patients over 2 years of age in seizure emergencies. Caregivers, family members, and school staff are often trained to administer this medication in the pre-hospital setting following physician orders. As all benzodiazepines can cause respiratory depression, verify with caregivers of the patient about medications that may have been administered prior to your arrival. Be prepared to support ventilations. Remember, only medicate if the seizure has lasted longer than 5 minutes.
Another situation where medication can help is when hypoglycemia is causing the seizure. Wait until the seizure is over and then check blood sugar levels. Dextrose is indicated if the patient has low blood glucose. If low, treat per local protocols.
In summary, give oxygen. Administer a benzodiazepine if the patient is seizing longer than 5 minutes or has repetitive seizures. Check their blood glucose levels and treat per local protocols.
Another decision facing EMS is whether to transport the tonic-clonic seizure patient to the hospital. Follow your local protocols on this, but also consider the following.
Transport is always recommended for patients having a first-time seizure. In addition, transport is also recommended under any of the following conditions. The seizure lasts longer than 5 minutes. A second seizure begins shortly after the first concludes. Consciousness does not return after the seizure is over. The person is injured, pregnant, or diabetic, or the seizure happened in water.
So you said you have epilepsy?
However, transport may not be necessary if the person has previously been diagnosed with epilepsy, has a history of seizures, is fully awake and oriented, and requests not to be transported.
Now, let's move on to another common form of seizure, complex partial.
I can't even get words out of my mouth half the time when I'm having the seizures. I mean, I don't know where my mind's at, I don't know where I'm at, I don't know where my body's at.
A complex partial seizure can occur when abnormal electrical activity happens in the area of the brain controlling consciousness. Because only a small part of the brain is affected, a person may be able to perform activity that uses gross motor skills, like walking, yet be totally unaware of their actions. They may also exhibit behavioral abnormalities that mimic psychiatric problems or drug abuse. The patient may stare, mumble, repeat phrases, blink excessively, smack their lips, pick at their clothing, or disrobe.
Can I help you?
They will be totally unresponsive to instructions and appear to be in an altered state of consciousness because they are, in fact, experiencing a seizure.
He doesn't seem to be responding to my questions.
The key to distinguishing complex partial seizures from psychiatric problems or drug use is the sudden onset of symptoms and the non-directed nature of their actions.
I just lose awareness of anything. It's almost like being unconscious. I'm told that my eyes will rapidly blink.
No medication is indicated for the patient suffering a complex partial seizure. Instead, assist in these ways. Avoid physical contact. Touching the patient could cause an involuntary but violent response. Approach slowly from the rear or side. Speak calmly and advise the person of your actions. Stay with the patient until he or she regains consciousness. At the conclusion of all seizures, the patient may enter a postictal state, which can last 10 to 60 minutes or longer.
I'm with the ambulance. You okay? Looks like you had a seizure.
During this time, it is normal for them to be confused and tired. Eventually, he or she will slowly regain consciousness and become aware that they've had a seizure. They should be given no pills, food, or liquids until fully awake. This is a good time to conduct a more thorough exam and collect witness accounts from bystanders. You can use the sample mnemonic. Signs and symptoms. Note the duration of the various phases of the seizure, the postictal state, any injuries, and cause of the seizure if it's apparent. Allergies. A severe allergic reaction may trigger a seizure, so ask about allergies to medication. Medications and anti-seizure medications. One of the most common causes of seizures in a person with epilepsy is abrupt withdrawal from anti-seizure medication, which can happen by simply missing a daily dose. Changes in formulations can lead to breakthrough seizures, and seizures can also happen as a result of an overdose of non-prescription drugs. Past medical history. Does the person have a history of brain injury, epilepsy, hypoglycemia, or diabetes, for example? Last oral intake. Events leading up to the incident. Ask the patient what happened just prior to the seizure. Get this information from bystanders as well. Lastly, determine whether transport to a hospital is required. Defer to local protocols when making this decision, but be aware that many complex partial seizure patients may refuse transport if they have a history of seizures and are familiar with the experience. In general, there's no need to transport the complex partial seizure patient to a hospital if the person is diagnosed with epilepsy. They are alert and oriented within 15 to 20 minutes. They are under care of a doctor. They are taking anti-seizure medication. They understand the risk of refusing transportation, and they can be released to a responsible adult. However, transport to a hospital is called for under any of the following conditions. This is a first-time seizure. The patient remains unconscious for more than 20 minutes or does not regain consciousness. The seizure lasts longer than 5 minutes. A second seizure begins shortly after the first concludes. The person is injured, pregnant, or diabetic. The seizure happened in water, or the patient is experiencing severe headache or other unusual symptoms. More than 3 million Americans live with epilepsy. Millions more suffer seizures for other reasons. As an EMS responder, chances are you'll encounter a person either experiencing a seizure or just recovering from one. For the patient, it can be a scary experience, especially for those who've had a seizure for the first time. They will look to you for reassurance and safety. Armed with appropriate knowledge, you'll be there to offer them answers, comfort, and care. For more information on seizure recognition, treatment, and epilepsy, visit epilepsyfoundation.org or call 1-800-332-1000.